Good morning, this is Jan Tedder welcoming you to the quick and easy update on how to use the new Well-Child WebSys templates. These templates reflect a review of both the medical and child development literature on what parents want and need from their well-child visits, as well as the evidence on what is most effective. I look forward to your feedback about these templates. They will forever be a work in progress. I'm sure I'll continue to make changes, and you'll make changes as you use these templates. My hope is just that they will give you both some cues, some ideas about how to initiate those conversations with families at the different developmental times and facilitate the record keeping. You will see that each well-child visit has been titled to reflect what is going on in the life of that little child at that time. So for instance, the 2-month is described as the watcher, the 4-month, the roller, the 6-month, the reacher, the 9-month, the retreater, and the 12-month, the walker. These titles are just to kind of get you on the right page as you walk in the room with a family. Next, you'll notice that I've included some basic child development milestones at the beginning of the template. It really is my belief and experience that if we walk in the room with a family and start right away reflecting on that baby's behavior, reflecting on what we see that child doing, that it's a great way to begin that visit and really establish that relationship in a way that'll be meaningful to that parent. Next, you'll notice that I've included the terms parent delight and parent worry. I think that a lot of us are accustomed to beginning a visit with questions like, what's worrying you today? What problems are you concerned about? And I find that it's really helpful to parents to start with a different question, which is, what is really cool about your baby these days? What is that 9-month-old learning that's surprising to you? Find out what really causes delight in that parent is a good way to get started. Next, you'll see that I've referenced the WebSys for the information on past medical, allergy, family history, because of course we do want to get that information there so that it'll be easily retrievable. Then we'll move on to more specific subjective information. For instance, under child and daycare, you'll notice that I reference a family being ambivalent about their daycare worker. And I think it's important to know that sometimes parents are surprised that they feel in some kind of competition with daycare workers who are experts about babies. I find it helpful to just reflect for a moment on that idea to reinforce that the parent really knows that child best. Under the heading of diet, refer to more specific information at the 6-month visit, noting a child's readiness to begin solids. Is the child no longer exhibiting the tongue thrust that would push the food out? And is the child starting to be interested in watching the parents eat? Under the heading of sleep, I've encouraged us to ask if parents can tell the difference between light and deep sleep. Also given information about the average number of hours that a child at different ages sleeps, as well as when their nap patterns might be changing. Under the family heading, I make reference to, is there any evidence of postpartum depression, and is the child being exposed to any tobacco smoke? Now we'll move on to objective findings, and certainly here we'll just reference the growth chart. You'll see that I begin the physical exam by making note of the parent-child interaction. And again, I'm wanting to be very specific here about what you can look for at different ages that gives us a window into how things are going between that parent and child. So we would expect that parent of a 2-month-old to be able to begin comforting and calming a child in ways other than feeding. You would expect the parent of a 4-month-old to at times to be so engrossed with her child that she's somewhat distracted in the conversation we're having with her. You might expect the parent of a 6-month-old to show us that she is following the child's lead rather than always initiating interaction with her child herself. And of course, with the 9-month-old, we'd want to see that when we walk in the room, the child hesitates a moment and then references or just glances at the parent before they glance back to us. We would want to see that this is a sign of the comfort they are receiving from their parent at a time when the stranger anxiety would be developing. By 12 months, we'd expect to see that same child referencing the parent again, but having a little bit more courage to venture out, maybe sharing a toy with you or walking around the exam room to come closer to us as the providers. I've included under the heading of development that the ages and stages questionnaires were done and were normal. We will continue to do these at each visit using the new 2-month ages and stages form. The 12-month ages and stages form has recently been updated and is a better screening tool for identifying risk for autism. You'll see that I've referenced using the Edinburgh at both the 2 and the 6-month visit. Under assessment, I know that all of you will have important observations and conclusions about a family. I've just suggested, though, that we give some attention to identifying what we might see as family strengths. For instance, a family might be really clear that in-laws nearby offer a lot of support and help with a new baby, or that they have a connection with a strong religious community that is encouraging and supportive. Or perhaps the parents of a teenage mom are encouraging a child to go back to school. And of course, when we get down to the plan, there's always much more that we could say than we have time to say. What I've done, I hope, is to choose some of the important items that can be discussed to give you very specific rather than general guidelines. For instance, instead of saying discussed development, I've been very specific in saying at the 2-month visit, I've explained that tummy time promotes gross motor development and that development occurs from the head to the toe. At the 9-month visit, I've discussed stranger anxiety and that parents might experience that the child fusses and protests when she is left at daycare and yet then falls apart when mom picks her up at the end of the day. And that playing peekaboo and using a lovey can help children during this time of transition. Under the heading of anticipatory guidance, I've described what we might see that child doing by the time they come in for their next well-child visits. So for instance, at the 2-month visit, we might say, by the time you get here next time, your baby will be rolling over. She'll be having such a burst in her cognitive development that she might be a little distracted when she's breastfeeding. And that her fisted hands will start to relax so that she'll be soon able to reach out and grasp a toy. That 1-year-old will be pulling to stand or cruising around, and that we'd expect some regression in a child's sleep pattern during that time. Also, the parent will notice a real burst again in cognitive development as a child will start to understand causality, that if we hand them a winding toy, the child will either try to wind the toy or hand it to the parent to do that for them. I look forward to hearing your ideas and experiences as you begin using these templates. I was just asking the big sisters, what do they think a 4-month-old baby will be able to do when he comes back in next time?
He'll be able to say a little word, and we could tell him if they're correct or not.
Yeah, and what do you think, Gabby?
I think he'll be able to read.
Thank you very much for being Child Development Specialist.